So we are aware of that. So cell is the smallest part of the body, that's the physiology. And so we are focusing on breast cancer. So breast cancer happens when some of the cells misbehave. They are not following the normal pattern of how cells are supposed to behave. They grow, and at a certain point, they're supposed to stop growing or they die. But in terms of cancer, then the cell continue to grow because something is being triggered. So basically, that is what it is. So breast cancer is a common condition where abnormal cells grow in the breast. So most cancer in women in Canada is lung cancer, then after that is breast cancer. Probably we may wonder, why is it lung cancer? Would anybody help us in Canada? Among women, there are two top cancers that are reigning. Lung cancer first and then breast cancer. Why lung first? Smoking tends to that Collins because the high rate of smoking. So if you remove lung, then the next one is breast cancer. So for us who are Christian, who may not be smoking, then this is an important topic for us because we are very susceptible to this. Breast cancer has nothing to do with smoking. Breast cancer represents 1/3 of all cancer diagnoses in women in the US. What happened is that in preparing this presentation, we used data from Canadian sources and American sources because our third presenter, Evelyn Menu, works at Kettering Hospital in Ohio in US. So if you are thinking about the American setting, it's 1/3 cause of cancer among women, whereas in Canada, breast cancer is the second cause. So it's pretty close. And as we did in the slide, 1 in 8 women, that's 1 out of 8, will have a chance, will receive a cancer diagnosis in their lifetime. So it's very close, it's very personal. Personal story. 2 months ago, I did mammogram. Previously, it's been coming out good, and then this one, the first report came, so everything is fine. Then 2 weeks later, I got another report. Oh, your breast is dense, and so now we have to do it every year. I was scared. So this is how close it can be. And prior to this, I've had other concerns as well. So let's not take it like, oh, it's them, it's not us. It can be anybody. So take good care of your breast health, especially with aging. So at the global level, there has been a 20% increase in the number of breast cancer cases, and the statistics is there, and we might be wondering, why is it growing? Why is it increasing, the incidence? So meaning of breast health, we are looking at us being more aware about our risk factors from this presentation, and then what is normal breast? How does it look like? Because when we are aware of our normal breast, both male and female, that's when we can detect or check if there's any abnormality or any difference and report quickly to our health providers and get help very soon. Then we look at breast self-examination and then breast cancer warning signs. So once you're able to go through this and be able to remember some of this information, then you are moving closer to knowing your breast and getting more information about breast health. Okay, so the risk factors here, some are modifiable. That means we can do something about them. There are others that we can't, So let's look at the risk factors. Anyone can have breast cancer, both male and female, because we all have breasts, just that in women it's more pronounced, we have more tissue. So anybody, the risk factor can be anybody. Then it increases more in women because of the high exposure to hormones, estrogen and progesterone. Men also have estrogen and progesterone, but very small amounts in their body, whereas we women have more. Then age, breast cancer is lower in women before age 25, but increases as we increase in age, especially up to age 60 years. The use of combined hormone therapy. So estrogen and progesterone, if we are using them, we are adding to our risk. It increases breast cancer risk. You may be wondering, where can estrogen and progesterone be found? Some are in birth control, some are in hormonal replacement therapies, those of us in menopause, the hot flashes and different signs of menopause. So sometimes we want to go for some medications. If they have estrogen and progesterone, some of them can be concerning. Though the research is not fixed about the hormonal replacement therapy for menopause, but just ask more questions as you get to know this information. Then, yeah, so I've talked about the oral contraceptives with estrogen and progesterone. If we have them and we are on it for more than 10 years, they can increase one's risk factor for breast cancer. Then genetics, family history. If you have first relations, that's either your mom, your sister, your daughter has been diagnosed with ovarian cancer or breast cancer, then there's high risk of also being having that condition. So some of these, the first says, some of them are not really modifiable except like reducing the exposure to estrogen and progesterone through the one we artificially take. The modifiable ones are the weight gain. The more we gain weight, I believe it increases more of the hormones and so could impact that. And then the hormones that are receptive to receptors. So one of the ways that I try to understand receptors is like the doorknob, the key. So the key, assuming this is the key, and this is the knob that we put our key to turn in. So the receptor is the knob, and then the hormones are the key. So if you have a receptor susceptible to estrogen and progesterone, so once the estrogen and progesterones are high, it fits into that receptor and triggers it on and can trigger that abnormal situation of having abnormal cell growing. So then they also talk about increased fat intake as a risk factor, obesity, alcohol intake, and then environmental factor like exposure to radiation. So those are the risk factors. I hope we'll be able to work on some of the modifiable ones to stay healthy. So, thank you. So this is anatomy of the breast. It's needed because we just want to use it to know where are the two main places that breast cancer occurs. So we have the breast, that's the tissue, the chest, the muscles there. And then inside the breast, we have the lobes. The lobes are the glands, those round ones like the grapes that we eat. That's where the milk is produced. Then it passes through the duct, like the pipeline, to the nipple, where the milk, for those in women, is ejected. So the gray part is the nipple. It's an area for breast cancer. The tube, like the tube, the duct, is also an area for breast cancer. So that's basically what we want to use this for. So to continue with the breast health, women of all ages need to be familiar with their breast and report changes to their health provider. So part of the breast health is let's be familiar, and we'll get to that point. What do we mean by familiar? Women ages 40 to 49 need to discuss their risk for breast cancer with their care provider. If you have a family history, somebody close by, let's say if it's mother's side, mother's auntie, sister, or if it's father's side, also it can happen, then you might want to discuss the risk with your provider so that the screening can be done early. Then ages 50 to 59 undergo mammogram fee every 2 years. This is a Canadian standard. So as we go somewhere in the slide, you realize that it's also say yearly. Yearly, I think in US, they do it yearly for women, even earlier than 50. But in Canada, ages 50 to 59. If everything is normal, the screening mammography is done every 2 years. Then once one reaches 70 years, I believe they don't really do. But if the individual has a risk for breast cancer, then that person has to discuss that personally with their health provider so that the screening could be done for the individual. So breast self-examination, about 10 to 15% of breast cancer cannot be seen on mammograms. They are detected by palpation. So this is why the self-examination is very important, and we'll go through this. About 10 to 15. It's still a quite a large percentage, though it looks small, but it's quite large. So mammogram can pick everything, even though it picks it at the very early age, but it still misses about 10 to 15%. And this have been found by people who self-examine their breast themselves. They palpate to find a lump or any change and report quickly. So breast self-examination, we are going to start. Um, there are 3 steps, and anyone can do it, male, female, and you can teach your children to. You teach your daughters, anybody, so that they do it themselves and can help them to detect any change and report for follow-up and monitoring. So for those in their monthly period, menstrual flow, you do the breast self-examination usually at the end or maybe 3 days, because at that point the engorgement is down, and so it's less painful, and then also it's less dense, so one can actually feel for any change like lump in the breast. If one is in menopausal age, you can do it at consistent time each month. And then you are looking for a change in how the breast look or feels, and report any change to your health provider if you see any change. So let's look at the first one. The first step is feel. Feeling is you are palpating. So you could do it either lying down or standing in the shower. So let's say you decide to lie flat on your bed, put a pillow under the arm you want to palpate. When you are on your back, the breast press up very well and it's easy to palpate. And then you use the 3 parts of your fingers, these 3 together, and you can go a circular motion or you can do um, the horizontal one. So just try not to remove your fingers so that you don't miss any spot. You may want to start either from the nipple or from outside. So you put your 3 fingers together. I see some people are doing it, and just go around. Make sure you are not missing any part. So your hand should be behind this way, and go around circular. Keep going, keep going until you reach the nipple, finish it, and squeeze the nipple to see if there's no discharge coming out. And remember, the breast starts from the clavicle, the collarbone here. I don't know what's the name. So you have to palpate. Yeah, conquer. You have to palpate from here. Then it also spreads all the way to the armpit. So you have to also go into your armpit, because you are looking for a lump, a swelling. Pastor. Let's ask our women if they are okay, if the men should do it. Maybe it's, I don't know. Let them answer. But it's something you do it on your own. So you finish one side, flip the hand to the opposite side, and do the other side as well. Both sides. That is when you are lying down. The other way you could do it is also when you are in the shower. After you've lathered your fingers with soap, and the breast as well, it's easy, it's slippery, so you can easily detect any lump, one at a time. So still, you complete this side and switch and complete that side. So that's the feeling, that's palpation. So circular motion, or if you are doing the horizontal one, so still you go up and come down. Make sure you don't miss any part. Keep going. And horizontally and repeat it on the other side, still going on the color in the armpit. So that's palpation. Then step two, check in front of a mirror. So we've done the palpation, the feeling. The other step two is observing. We need to see how our breast looks like because breast cancer causes changes in the breast. So just stand in front of the mirror, hands on your side, and just look at, and with clothes removed, look at the shape of your breast. Usually they say one is slightly bigger than the other, but know the normal, and then when there is a change, you see, you can put your arms on your waist, above your head, and just look at the changes in size and shape. Then the third step is schedule a yearly breast examination. That's this physical examination, palpation with a healthcare provider, especially if you are in that um, age group or you have a risk factor. So this is just a demonstration I did. If we Google it, there are so many of them online. The warning signs, change in size or shape. So you would know your normal breast, how it looks. So if there's any change in the size or shape, you need to report that. Dimpling or puckling of the skin. Usually the skin of the breast cancer looks like orange skin. So if you see that kind of skin on the breast, that is not normal, your normal skin, then you need to report that as well. Then itchiness or scaly sores or a rash on the nipple. The thing is, we should know that not everything is breast cancer. We have benign situations as well. So you report and they will do the test and find out if it's breast cancer or not. So don't be alarmed when you see these changes, please. But it's important to follow up as soon as possible. The nipple discharge, if there's any discharge from the nipple, especially one is not breastfeeding, and those discharge are coming, you need to follow up. Then pain in one spot that does not go away, pulling in of your nipple. If you know the nipple is usually out, but if this one is pulling in inverted, going in like this, then it's also another warning sign. Swelling or warmth or redness or darkening of any part of the skin of the breast. So early detection, breast cancer outcome is detected, I'll take it over. Breast cancer outcome is detecting the cancer early and receiving treatment early. The good news is it's one of the conditions that is treatable. So when it's detected early and treated, there's no alarm. It can be treated. Breast cancer found early is small and has not spread to other parts of the body. Early detection services could include mammography, ultrasound, clinical breast exams, MRI, and other services. We are not going to go through any of them, but these are some of the information is repetition, so I've gone over some of those already. So regular mammogram can help find breast cancer at early stage, finds changes in the breast that can be cancerous before physical symptoms develop. So that's the advantage of mammogram, that it will identify a change in the breast before we start seeing those warning signs that we talked about earlier. So it's very important that we do the mammogram, especially women. It could be twice, every 2 years, or it could be yearly, especially from ages 45 to 55. Then the treatment, it depends on the stage that the cancer is detected. That would determine the treatment. So the road to the treatment can be difficult and individuals need support. Need cutting-edge treatment with educational, emotional, and spiritual support. So if you know anybody going through that, support them. Say, I'm praying for you. You know, give them that encouraging way so that they can follow through with the treatment, because It's very tough, it's very challenging. Yeah. So the treatment, we are not going to go through them, but it can be administering of hormones, since we know estrogen and progesterone are the main hormones that feed the cancer. So if the cancer receptor cells are susceptible to those hormones, then they will find a way to use hormonal therapy to reduce that estrogen and progesterone, or even to kill the cancer cells or prevent um, the receptors from having access to those hormones. So that's there. Then chemotherapy, and then there are other things, radiation and surgery. So those are the different treatments available. So the treatment, as I said, depends on the stage. The stage meaning the cancer has not spread to other places in the body, because we have lymph nodes in our breast and armpits. So these are small, small nodes like grapes, but what they help is they help remove fluid from the breast and the arm. So if the cancer hasn't gone there, because when it gets there, because it's fluid, lymph is fluid, it's send the cells very fast into other parts of the body. So if the cancer hasn't gone to the lymph node, that's very good. If it's gone also, it will determine the type of treatment that will be suggested for the individual. I'm not going to go through this. Sometimes the surgery that is done for breast cancer is mastectomy, and we just put this there because it's most of the time the common one. And once that is done, because it depending on the type, the lymph nodes are removed. The lymph nodes help to remove excess fluid from the chest, from the breast. So when they are removed, they cannot drain the fluid from the part of the body. So sometimes you see the individual's arms swelling up. So that's why you need to be careful. Usually, not doing so many things on that arm, like taking venous blood or blood pressure, And sometimes they also prescribe certain stockings to help pull the fluid back into the body system. But usually you see that part of the breast where the lymph nodes are removed, the arm is very big or swollen, especially if the fluid cannot be drained easily. And so we just brought that there so that we can be aware of that. Then the chemotherapy are cytotoxic drugs. So these are drugs that are harmful. Just as it wants to kill the cancer cell, it will also destroy some normal cells. And so we want to be careful how we come in contact with it, especially even if we are not having cancer, but we have somebody, family member, taking those medications, disposing them and coming in contact needs to be done carefully. And because the drugs are also killing normal cells, the person exhibits other effects like low white blood cell count that protect us from infection, and then sometimes nausea, pain. So these are all side effects that come with cancer treatment that we can support the individuals, and people have used different kinds of other, how will I call it, complementary therapies to manage those complications, because they are painful, but they don't want to add another medication to it. So sometimes other complementary therapies are used to help them handle the side effects. Okay, so I've talked about the side effects. I'll conclude here, and then we can open the floor for questions. I know we have some experiences or questions, and we can all increase our awareness on breast cancer. So early detection of breast cancer can be treated, and we need to follow the breast health guidelines and also engage in proper lifestyle to stay healthy. Proper lifestyle will include some of the modifiable things, managing our weight, managing the food we eat, the amount of fat, different things that we know that can keep us healthy. This is the conclusion from Sister Ellen, myself, and Evelyn. Then we are in the era of generative AI. I asked AI to give me a summary. And this is what Copilot said. Breast cancer can affect both men and women. Knowing the warning signs, understanding your risks, and seeking medical attention early can save lives. So, very good. AI is now helping us. We don't have to think too much about what to say. Thank you so much for listening. Any question? And these are references. If you want to learn more about breast cancer or any form of cancer, go to the first one, Canadian Cancer Society. If you just Google it in, you get to their website and they have so much information and very simple, easy to understand. I think we have some pamphlets outside too. Yeah, okay. Thank you. All right. Any question? Question, but I'm going to answer because I know we have several ways of managing.
Are we going live on this? It's a sinner. Question
Yeah, maybe we could take the question part from
yeah.
live streaming so that it can be maybe interactive.
Okay, question number one. Probably you take notes so that you can answer them. You said there's 20% increment or increase in breast cancer.
Globally, yeah.
I would just want to know what accounts for that.
Okay.
Yes. And then number two, what can married men, emphasis on married men, do to help our women from getting it? And because I had a doctor, it's a naturopathy, or naturopath kind of doctor. He was saying that sucking the woman's breast as a married man. Oh, allow the pastor. That's what I heard. These are some of the things I said you should not go online. No. Sucking the breast helps prevent breast cancer. Is it true? And then, somebody has already answered it. That's good. And then, in terms of lifestyle, what would you recommend for women in terms of lifestyle to prevent it? And are there certain food that we need to prevent or we need to eat in order to, prevent breast cancer?
Thank you so much for your question. Please hold on to the question because I didn't come with a pen, so I didn't write them down. But the first one, the 20% increase, I really do not have an answer, but I'm thinking it has to do more with lifestyle, with exposure to sedentary life and what we eat, what we eat in terms of increased fat in the food and obesity, because these are all risk factors. So I'm thinking that could be the cause. Especially breast cancer is very high in Western country. The problem is that here, the resources are here, so they detect early and treat them early. So we don't see the side effect very much. But back home in Ghana, the problem is that the screening, as at the time I was there working, the screening wasn't very common or announced, so people come to the hospital at the last stage, of breast cancer. So we hear them dying more over there compared to here. So the 20% increase, this is my thought that it's more about the lifestyle. Please, anybody in the audience that will help us? Yes, Lapi. Oh, thank you so much. I'm sorry for those who are elders if I'm still using your first name because we've known each other for a long time. So forgive me.
Oh, man, it's okay. It's okay. I think so, something that has been happening now is that a lot of people are not taking care of their health in terms of work. I don't know if you've noticed it. There's been more emphasis on people spending more time working, the stress, because what people don't realize is stress also does cause a lot of our immune system to go down, which gives us that opportunity to be able to have an increase in all that.
Response to the first one.
Second aspect is very important.
Okay.
I want to know whether it's true because I hate to know whether it's true because I heard
Well,
you say it's true.
Okay, Sister Helen Sobe answer second one. And then Sister Debbie, I think me who Sister Debbie's Hannah.
The breast sucking, I'm going to help a little bit, but we can do more research also to make sure, say, it's research backed. But the rationale behind that is, on say oba wa, enufusu na eba no. Ema nkra nom omo nufusu no, nufusu no kemu no. They are also at risk for this disease. So I think the rationale behind what you are saying, naturopaths, can say, if you suck the breast, it releases all those enema. But like I said, we have to do more research but that's the rationale. If it's a one breastfeed baby, that's a no for no engorge.
Sorry, Ubia. Sister Debbie.
No for no. It's not good. It puts you at risk of it. It's a to me it's good. Yeah, it's a good thing. But there's
Sister
let me finish this. Yeah. And the question about I would say, what can men do to support the women? I'm sharing this personal experience. I don't have a history of this in my family. Me need genetic factor be me need anything about that. But number one can be stress. You can be a vegetarian, you can be a vegan, but if you have bitterness in you, complaining, whining, it kills your immune system that is able to fight anything that is coming into your body. Because God has made this body, it can heal itself. The body is an amazing organ. And where to me healing, you probably won't put anything on it. And this is your immune system fighting for you. Vegetarians and vegan, it's okay to stay healthy, but be mindful of bitterness and anger, any complaining. That is number one, especially for us Christians, because we know say now you war in Michigan. There are a lot of vegetarians in the Andrews community, but obi from would be a cancer. Why? And tontroma diane any sodium no more de account hono. A man, the mobile the babu no. To reduce their stress, Ubana or for a kitchen. Now, recent, I'm taking too long, but let me share this. Let me share video social media. Mrafumi no. I'm so mrafum kwa ne betimi ayewe. Obano or say I'm planning my friend's shower. I don't have food in the fridge. I'm doing this. Wakasasa wama be my ground home. And a bear man say, now what if ye? When ye juma, I mean, I make juma. Then the scene changed. Mamma complaining, son, papa no. Was say, honey, I got this. We will order something. I said, no, Casa was say, honey, I got this. I said, I got this. I said, mamma no. The stress in a co. No money in any aji. So to answer that question, a man no be fear. The women no age na ya dream no. Hormones are ranging. Everything is, or so the burden is so big. So what you can do is to release that stress.
Sister Debbie, and there's a hand. Okay.
Hello. Hello, 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 hello. Hello, 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 hello.
I don't have any professional expertise on it. I just deal with numbers. Okay, I think that I was going to contribute, and then I have a question to add to the earlier question about why it's increased. I think even in the West, because there's more technology to be able to test and find things out early, because Emma as a rates ni increase because it's being found out as much as possible than before. And I'll take myself as an example. Said the Auntie Ellen Kai, I have no family history of breast cancer, nothing. But I think 2023, now my doctor can say every time we do your mammogram, it says you have dense breast. And I'm very petite, as you can see. I can pass for a teenager or anything. But I'll say there's another test that I want you to get done, which is the ABUS, which is the automated breast ultrasound, which is an add-on if you have dense breast. Until once that was done, and then they said, oh, they found something. Whoa, this is the very first time and so as usual, panic, and I'm like, okay, let me calm down. And so the doctor came to talk to me, the imaging doctor, and said, okay, we found something. We think maybe it's nothing, but as per process, we need to test it. So you need to have a biopsy. See, and then I got it done. And then the test came up. They said it was. So with the different types of imaging and whatnot, things get caught than it, because if it was just the mammogram, they would say, okay, then so everything is fine. But now they found, and then I had to be under surveillance for a bit. And they said, okay, nothing is happening, it's stable, so you can go back to your 1-year check. So I think that might be another reason. My question, Nise, statistically, black or people of black origin are more predisposed to breast cancer or things happening with the breast than, let's say, Caucasian, Asians. Is there a reason why that we are more predisposed? And I say, just our genetic makeup make us more predisposed to that one. Thank you.
Thank you so much, Sister Debbie. That's quite interesting, but I'll need help. Mpacho, you defer to doctor. Please go ahead.
All right, so I'll start from Pastor's question. So, a lot of people have said things about your very first question, which we all agree is one, the change in lifestyle, and then the risk factors, and especially in where we find ourselves now. I mean, you can have a child as early as 14 years on contraception, and so naturally that increases their risk of developing breast cancer and some other female cancers. And then the second one is what Mami just talked about, the fact that now we are able to detect more. And so then naturally we'll see that we are getting more cases than we used to. Now to the second question, which I think is a bit more interesting than the first. There is no scientific evidence backing the fact that sucking the breast reduces your risk for breast cancer. Breastfeeding, on the other hand, if you breastfeed your child for a year and over, it reduces your risk of getting breast cancer. Now, the difference is that when you are breastfeeding, the amount of hormone you produce, the estrogen you produce, is reduced significantly. And so your exposure to the hormone is reduced. and thereby your risk of developing the cancer. And so, Pastor, I'm sorry to burst your bubble, but sucking the breast has no benefit at all. For a man to suck his wife's breast doesn't reduce the risk in any way. So that's it about the breastfeeding and then suckling. The other thing I wanted to mention, and Sister Vivian, thank you so much for this excellent presentation. Now, in Canada, we no longer encourage self-breast examination. Now, the reason is that, like Mommy said, she had gone to do a test, and they picked up something. Naturally, she will start panicking. And we've seen that a lot of people have false positives. And so you do the self-breast examination, you feel there is something there. It ends up being nothing. But you go through a process. So you do an ultrasound, you do a mammogram, you do this, you do that. And then maybe after about 4 or 5 months, they now biopsy, then they come and tell you, oh, it's nothing. And you would have put yourself through that stress for 6 months for no reason. And so we no longer encourage self-breast exam. So again, coming back to you, Pastor, what can the men do to help their wives? Back in the day, I would have said, examine the breast for them and make sure you know your wife's breast so that if any changes occur, you can pick it up. But nowadays, we no longer even encourage self-breast examination because of the false positives that we are getting. But structurally, she mentioned some of the changes that happen, like the skin, and usually this is even far advanced, the skin becoming like an orange peel. Those ones, when you pick it up, you have to report. When you notice that your wife's nipple is going inside instead of pointing out, those are things you should be concerned about. And so we don't do self-breast exam, but we encourage you to know and notify the significant changes that happen in the breast so that you can report them. Amen.
Amen. Thank you so much for bringing the self-examination. Sister Helen, we talk about that, right? That in Canada, they are saying no self-breast examination. But personally, breast, it's funny. If you are into research, today they will come with, this is disproved. The next day, they bring another issue and bring it back again. Personally, the reason why we included it, we talk about it, but I said, let's include it just for the information because it doesn't hurt to know and do it. It's you doing it on yourself because this same information that researchers are saying it doesn't work, let's give ourselves a few years to come. They will bring it back. Anyway, that's just the perspective when you are going a little bit further into
Mama,
research and things. Thank you.
Mama, a quick follow-up.
Yes, please.
I am praying that researchers will soon come back and tell us that what Pastor is saying, there's an iota of truth. I'm praying. That is one thing. Secondly, doctors' bit of addition still come back to us that as husbands, we need to see and know and help you to know if there are any differences. Whether we are smooching it rightly or observing it, we still have the ecclesiastical powers and the moral right to know. So it is beautiful for you to be romantically and attractively available for the men to know how things are going.
Please,
it is for emphasis.
Amen. In response to Mommy's question, I don't know if I can do justice to it very well, but I think that white women have a better health-seeking behavior than we the blacks. And usually, we would only go to hospital when we have a problem. And so by the time they are picking it up, it may probably be a late-stage disease. And I think these are the things that account for the disparities in the statistics that we see between the black population and the Caucasians. But yeah, I think that it's neither here nor there. Yeah.
Pacho, me pese me di bibi kakra kande me man betimi ayo. Evelyn works in oncology unit will hire you. The Evelyn can say one of the things she's seen is that a man or modi prosthesis, but breast implants, silicone and all those. They come and it's so infected and it gives them so much problem. But why would they do that? All to please their male partners. So I think we need to appreciate our women and let the person know you appreciate them, because some women refuse to go for mastectomy, different thing, because and all those things delay some of this help-seeking behavior. So as you are getting this information, you are supporting your spouse, let them know that you are there for them. As we are aging, things will change in our body, and we pray that God gives us good health. Yes. What time do we bring this to a close? We have 4 minutes to 12.
Oh, just a quick one. Respect to bra, the women, has it got effect? The tightness of it, the looseness of it, wearing it for a long period of hours, time, etc.
It's a good question.
Yeah.
You have to let it rest. Can say too much tight of everything, no. And one pediano. Other cancer, breast cancer, crime, you should always let air circulate in your body. To say, obi or how I share jeans, no, boxer, it's really tight. There's no air going there, so that's why people get a lot of infection, UTI, and this. So as much as you can, let air circulate through your body. Because it keeps it dry, and chances to say, bacteria, it's limited. Yeah.
I think the simple answer to Pastor's question is no. The length of time you wear the bra, how tight it is, whatever about the bra has no bearing on breast cancer. But like she mentioned, I think in October every year we do breast cancer awareness. And then one of the slogans we say is free the tatas. So occasionally you have to free the babies so that they can breathe. Amen.
Amen. Just a quick contribution. From a research perspective, I'm saying now we can risk factors. No? Now, recently, researchers identify alcohol. Me ba krum han me hu se enkrofo enom alcohol smoking so rampant pa. Now research am hu se there is a protein in the blood. Your friend say estrogen binding globulin. Onom alcohol it reduces our protein. Proteins so adwuma en say bind it to estrogen so that you have less of the free estrogen nam or blood no ma etimi predispose you to breast cancer no. Now, no alcohol, suppress it, protein, no, form. You have a lot of the free circulating estrogen, in your blood. And also, it's breast cancer, and it's The other thing is about refined carbohydrates. And also, researchers, I have research, and saying, baby, I mean, who said, especially a matter snacking, or ye be kakra, not what far we know what Africa cra, na within 30 minutes, what far. Donut. Also, a map is no pa. Now, research I who said, Sa enuana a ma insulin, kakrabiana ins because we did those refined carbohydrates now. You have your body producing a lot of insulin. Now, the more nipaduane produce insulin, na sustain in your blood, no, and also predispose the body to developing breast cancer. Tiensha sa annual super alcohol, refined carbohydrates.
Thank you so much.
Bad. Mr. My question is,
Yeah.
Doctor, what you sorry? Go ahead, sorry. So my question is, who can say me man and sunya breast cancer? I shock me pa na. And so my dear Tom sa. I'm sure me man no. E bi mo ho am breast no e flat. E bi no so die sisi ho. O mo die hin na enya.
Okay, me obi wo ho a minimum na as a Ghanaian na ne body ni ye flat but onya breast cancer be ye kotwa bema am ye yi afri. Yes. Yes. Yeah. Nti so for emfa ho say ye flat ana say ejina ho.
Oh, yeah. Chemo. Minimum se bia wo chemo so a. No e bo ana se moa. And
for treating breast cancer.
Yeah.
Oh, Eboa. Once it's been diagnosed, depending on the stage, say chemo na use, so they will make recommendations. Eboa, but just that the same chemo na destroy cancer cells will also be destroying some normal cells. Into nipa ni benya side effects, but Eboa, it will kill the cancer cells and eradicate it. Yeah. Any other comment?
I think you mentioned mastectomy, right?
I know your surgery. No?
Yeah, lumpectomy. Lumpectomy, it's when sebi ade no enye nufo ni nyina. Mastectomy ne yeko yi nufo ni nyina free ho no. Not possibly surgery to replace it. But se nye bibisa ne adua no hye baby localizer. We call it lumpectomy. Yi keke free ho no. Nhia say yi wo no fu ni nyina free ho.
Yeah. Thank you. Any other question, comment? Yes, Gideon. Yes,
doctor.
Me want to say. Me is a question about the breast. But say, I'll try to get up.
No, you can sit. It's okay.
I just want to talk about health support. Health support in general. Whether you are sick or you are well, you need to eat to support your health. I would say, for those who know me, for a couple of years ago, I wasn't like this. I was an active young man. In my, how do I describe it? Like I'm at the peak of health. But suddenly, I begin to experience some numbness in my limbs. With time, I saw the health. I met with my health provider and he said I should go and do scans, CT scan, and all those examinations. And it came out that I'm having cytosis. Some of my cells are dying. And they couldn't find out what is causing it. I'm beginning to think about my environment, the air I breathe, the food I eat. And so what I'm saying that for us to maintain health, we need to eat appropriately to support our health. I want to encourage you that you look at what we, in particular, the fresh ones. It's not all the greens that are good for us. They may appear healthy, but if they are chemicalized, it's serious. So a word to the wise. Thank you.
Thank you so much.
Thank you so much, Doctor.
Yeah.
God bless you for that. God bless you.
Any other comment? Oh.
I'll see you later.
Yes. Okay, Sister Debbie.
Emmanuel, and this is research based. I would say you use chemicals be break, the cleaning, spray, nail polish, all these things has chemicals in it. And I would say you're very mindful. And your time beyond I was a spray there are a lot of things you can use to say oils. And vinegar is very good. Baking soda, over to me where you come at. So what happened is that I made a lot of changes. Our environment, plastic, I had this microwave, and I think that by now they ain't saying, especially Mema. There is a research say Mema or Munum. On sense you need to hire to near the good can. Now, yes, she. If you are now, do not offer no one. Especially for the men, you have to be very careful because almost say to me, wiking will spam. Yeah, so maybe we can do a little research on that. Yeah. And I say, dear, what the plastic I did share microwave because the chemical is going in your food. Now we are the debia, nyamia na akofaya re abro. Not necessary say be cancer, but it can cause a lot of enema ewonipeduenum.
Thank you so much. You said we are very engaged and the topic is interesting, bringing more health promotion topics, but we need to bring it to a close. So we are grateful. Tomorrow at the same time, there will be another health presentation. So please come. Hypertension, stroke is another common condition. That's the one that affects Black population by race, and it's not modifiable. So let's come. Yes, Edda Collins. Thank you very much, Ed. It's a good conclusion. And the task I'll give to each of us is, let's decide at least what small part of what I've heard today will I take to modify my lifestyle to stay healthy. Just baby step, and it will make a big impact in your health. Thank you. Pastor Mofa, you can close for us with prayer, and if there's any other announcement. Thank you.
Dr. Vivian, that was a papa. We want to thank Dr. Vivian and her team, Sister Ellen, and all those involved in or part of Winifred, Dr. Winifred, and other doctors that are part of this team.
Sorry. There are just some few announcements. We are asking and encouraging, say, if you are here to make your payment. Okay. Hello. Sorry. Hello. Okay. Amika said there are just some few items. The first one will be your camp fee. You know, meaning say move video now will be transfer. That will be very important. Yeah. Yeah, into me and we payment, you know. Pacho, yeah, no, be home now. Yet me asset payment, you know. There is room number 211. Minim say be a key abedi wa measure sell be hona dia mami. Based on that, me encourage you, we should not lose our key. Yelusuki na they charge us. And last year we had a lot of the keys missing. Association, you know, it's a key cost. But this time round, it's kind of it's a Lusuki. You pay for it. Because room numbers no, we have your names to your room. If Irina key is missing, I'll send you a bill. The toss will be how much now is it? So I know you just misplaced it. Yeah, share program number. So unye bi I know Sister Debbie Wechero Obema will be. Na most importantly, in her time now also no say be a 10, 5 a.m. near Waha, near alone with God, and program can keep going like that. There is also a token, a gift, association in May, because you are celebrating our 10-year of God's goodness. A pen and a shopping cart. I've forgotten the name. I said key holder. Bisa. You shopping. I was there. We hear that dollar or that coin to be able to use the card. With that, no, you don't need to have a dollar or whatever with you before you're able to use it. Let's see her and have and get our gift. Lunch is at 12:20. Let's eat quickly and come back and make sure that you continue with all the other information and asset programs at 12. So, we are able to resolve it. Let's talk to one another and help one another for us to experience God. One last thing, are checking in. Youth for free more. We are expecting more than what Inti unmobi or a neighbor now where we came here to have a relationship with God and to have a communication. And you can see it's not if you're YouTuber and I said that's not the objective. So let's make sure we are bringing all of us here.
Thank you, Pa Eda, for so cancer way. So say you move no more. Still, yen rooms no omo maha. Yes, already say already no kasa employee and out with this announcement say obefre yenu ya no mo bi na fe yen nyina yetumi ahia ha say sanse ya ba for camp ya ma for just relaxing in our rooms. Your session drew on eba no and also very, very interesting. Na me gidi say mobema ye nyina ye involved na ye busa questions we na fe yen panel no and as a panel members and also etimi aboye answer questions when it comes to dating and courtship. Gidi say your next come meetings no ye bema health presentations no adults on marriage any other stuff. Adults me gidi say idea ye niji hopa no so for make say they can ho asem kire me. Na obusa say ntiyentimi ni Ghana aduane so ana ye aduane no ye behwe akire all throughout your days ye bedu no ha no ke bia ye ni Ghana aduane ye behwe akire. Yo enti ye da health team no ase unum say Dr. Vivian ya no pass me for no doctor but we your doctor or Saskatchewan na wo kirade wo university bi ewo ho ewo so doctor pacho bradum hanama ye hunu university na wo kirade wo no briefly yesere opin pacho bra na bia na wo recommend school no de ama Ghana ni bi ho.
Yeah, well, not that university. Sorry, Pastor. How can I advertise mine here? Pacho, my PhD, a Doctor of Philosophy. So I'm a registered nurse by profession. Until media, Doctor of Philosophy in nursing. University of Regina. I was Saskatchewan, Faculty of Nursing. Yeah.
Yes. Na said musi hunu no saa no te obre no ho ase pa. Ahobrase no na ofere ade so pa. Dr. Dr. Robert Tihosa say, sir, Dr. Yojina, who I say, Minino Waswa. And we are number bondi, come on. The Dr. Vivian could introduce who to Professor na Nkonenim. Yada was a pa, so I said, you know. Meneno Nanewo Aswa, now I am a senior. Aswa, Dr. Vivian. Na Oboy and Pa, baby a cotia, sorry, you call your church planting, no, na a ho, and na one in the family war. Aha, and yada was a pa. And also, Anne Nikuno and started Edmonton Church. Or me founding fathers, no, Ebia, Dr. Puplampu, and Yami Enshra Pani Juma, why no Edmonton, a co-Edmonton, ya 2 deep, and Yami Shra na Uncle and so mo. Yo, Yadamwase, Yabefre, Mepu, oh, sorry, Sister Ellen Patobra, most table will be a chiroho, Patobe can't want some cacrachena, yet to me, Abaho.
Pacho, yes, table be or ho. If be officer will check it with sugar or more. We are diabetic, maybe crowd if you want, I will poke a ma. You will need nebby or I feel person check with blood pressure and all that. Yeah, well, pamphlets be or about stroke, breast health. You can also pick one. Yeah. But Minka way, we are not here to scare anybody. Even if you get the diagnosis, there is help. Breast cancer is one of the cancers I want research so much say you know we okay. And God is our healer. And I'm just encouraging you, no fear with this, just empowerment and education to be aware, say it's there. Anybody can catch it. But taking care of your body, and if you get it, so what? People get it. It's not, you are not alone, and there is help.
Amen. Yadamasipa health team Yami Enshiramo. Yami Shiramo. Your next program neighbor no, you be table with her. Now for the church, see her for yen panelists no. Afi your next program no ye and pay also for make the church ye testimonies no, any prayers no. So testimonies be a so brabe home na mentro wodi and to her na ye be free ama wonso obedi adanse ye. Nti ye be free your music team no ma beto aso amaye. Pray, prepare your home for the next session. But you where? Oh, okay. Oh, after that lunch. Oh,